Hey guys, it's Dr. Emer. Do you notice anything different about me today? I was filming this morning, so I actually have makeup on, so I probably look a little bit better during this filming. But and my dark circles have improved, so it's not the filler, it was the makeup. But I have one of my patients here today who comes in every so often to do little tweaks, and the reason I like showing her and this treatment on our Instagram and our social media is because she doesn't look like she's had anything done. She looks very natural, very pretty. Loves taking pictures of herself, which makes me happy. But we've done a few things. We've done some treatments on her neck to tighten her neck. We've done some filler in the cheek area and the lips, and you wouldn't know. That's the whole point. And in the past, many people tried to hide that they did cosmetic treatments, but everybody knew they had them done because the work was so bad. Now, everyone wants everybody to know they had it done, but the work is so subtle that no one can tell, which is what, to me, is good natural work. So what we're going to do today, she has a beautiful angled jawline, which you can tell, and she has really nice high cheek and sort of projected chin. That is what we call the triangled face or the heart-shaped face, which gives women a proportionate beauty, and which I'm discussing this weekend at a AACD meeting. I forgot which one, in Marina Del Rey, so if anyone's there, I'll be talking. But what we're going to do today is just enhance that a little bit more. Some women like to have a little more elevation in the cheekbone, so when they turn to the side, they have a little bit of an angle. And then we're going to soften the chin, not giving it projection because she already has that, but softening the lines around here, because remember when I talk about chin, we want to anatomically correct it. You don't want to just push it forward or make it wide. You want to soften the whole area so it blends into the jawline and it prevents jowl formation. So lay on back, we're going to use a cannula, which is a little, smile for a second, relax. We're going to follow a line that goes from the corner of the mouth to the top of the ear and right at the lateral part of the eye. We're going to make a little injection site. That's the worst pain that she's going to feel. That little entrance site's going to allow this cannula to go in, and we're using a filler called Prolinium Versa. The reason I like this is it's pre-hydrated, meaning it's not going to swell that much, unlike other fillers that hold water. This does not. And it's really soft, so it looks very natural. Go ahead and grab. So we're going to turn her just a little bit. You can see very minimal bleeding. It's a weird sensation. I say 1, 2, 3. We're going to go right along the bone, right to the deep medial fat pads, and we're just going to go right on the bone. And our goal is right here. We want to create that illusion that she has a pop of her cheekbone. Okay, not necessarily much more size. It's more about shaping. How's the pain?
It's fine. I barely feel it.
Perfect. And see, again, you know, we can use a needle, which causes a little more pain and trauma, but the cannula allows us to kind of target larger areas through less insertion point, and it's just less painful. So some areas I have to do it, and what we're doing today with her, we really don't. So we're going all across that upper portion of the cheek, because we really want it to pop. Now one thing is, don't forget this lower malar area, this lower portion of the cheek right down here is where all the makeup artists enhance these two areas right there. So we want to create a little bit of a line right there. So it creates like a subtle enhancement there. Perfect. So not much pain at all and almost no bruising or bleeding, and I can look from the top and see that the angle is perfect. Turn to the right. Yep, looks great.
All right.
Yep.
Okay.
Turn this way. There you go. I know. Right here.
I've been flying all day. Sorry.
It's okay. So again, just that one needle poke.
I flew 6 hours just to see Dr. Emer.
Oh, I love you.
That's how great he is.
So sweet. And I'll be flying over there too very soon to teach, and I'm going to make you come hang out with me.
Sounds great.
It'll be great. So again, and for her, we're just using half syringe, just a little bit. Can always build on the filler, and she did have a great question today, which I love. She asked, and some people do fillers metabolize more quickly? And remember, these fillers are sugar-based fillers. So if you exercise a lot, you're very active, have a lot of facial movement, you're very active, fillers can last less amount of time in you. So that's why certain companies have made newer fillers that are cross-link a different way to last longer, but they don't always do that for everybody. So it's always estimated times. Good. It's always estimated time points, but sometimes the filler is going to go away a little more quickly in others. Now, if it's a week, then you don't want to use that filler because your body just metabolizes it. But if it's after a few months, it may be you either need a little bit more or you need to change the product. Now, what I'm going to do is we have one other syringe we're going to use through here, but I do want to give her a little bit more posterior lift. So I'm going to go all the way down to the bone, and we're just going to do a small depot just to get 2 major points, and then we'll use the rest on the chin. Okay, one there, and one right at the apple of the cheek, right here. Just a very small amount, and this is in a different plane, so we just get a little bit more lift, because I want her, when she puts on her makeup and everything, to feel like her cheeks are popping. Smile again, relax. And then right at the apple of the cheek where I want to get a nice lift. Perfect. Okay, hold right here for her. Now I'm going to switch back to the cannula. Thank you. Now we're going to do the music. So now we're going to soften through here because that's her main concern. And we can do it through 1 or 2 insertion points. I always tell people this area feels, you sometimes feel it a little bit more because we have to go under and around the muscle. So I always kind of tap here, 1, 2, 3, perfect. And we go all the way across. And even though there's nerves and blood vessels there, nothing's happening. The other great thing about this treatment here is it softens the line, but it actually pulls the lip down slightly. So you get an eversion of the lip by doing 3-dimensional contouring of the chin. As we age, this area starts to go inward. So this really helps prevent. And then what we're gonna do, the last amount, look all the way up. We're gonna take this cannula and go right here to the lip corner, okay? Now again, major blood supply coming from here and here, totally safe when we're using the cannula. And that's going to give her a little upturn in the corner of her lip. And then we're going to come down, we're going to go right on an angle on the chin and create just a little bit of a shadow here so it looks like her chin's more angled. Perfect. Soften on that side, switch with you. Last part, I'm going to come right here, make again 1 little poke. Take this one. Now we've already filled a little bit anteriorly here. Let's see if I can get. Sorry, honey. There. Okay, just a little in there, and again, we're going to rotate right up here to that lip corner. Very safe, just putting a little bit in just to help the marionette lines and turn the lip up, and then we're going to turn back around, go right down to the chin. That always feels a little weird because it's through the muscle. Now we have a softening, and if you look to the side, look, this is what I love. Blended, nice, and I call this the Sandra Bullock chin and jawline, and then the high cheekbone. This is perfect. So elevation here, elongation and softening through here. It looks great. So that's female facial sculpting using just a few syringes of filler to get enhancement. Let's show her real quick. So she sees, if you guys can grab the mirror behind you, let's grab it, give it to her, and then let's see what she thinks. If she hates it, she'll let us know. What do you think?
Oh wow, looks awesome.
Obviously people are swollen and look crazy right now.
Yeah, it helped blend that area
But
so
it
much
did,
more.
especially if you look to the side. Now what we're going to do, and we'll talk about this next, is softening here with the little Botox, and then obviously here, but then look, now you have high cheek, nice jawline, blended
Yes.
chin.
Looks great.
Perfect.
I'm very numb, but it looks great.
Good. All right, and there.